Hello, and today we are talking every single thing you need to know about melasma. We're going to do an overview. We're going to talk how it looks, what causes it, what is the melanocyte all about, how do we diagnose this, and how do we treat it. This is a treatment algorithm to whet your whistle for what we'll talk about, but we're going to talk lifestyle, over-the-counter products, prescriptions, and procedures as well. So first of all, what is melasma? Melasma is hyperpigmentation that we see more in females than in males, and it generally starts at about age 30, and it includes 1% of the population, though it's more common in some parts of the world than others, and treatment is very challenging. It's often associated with depression and embarrassment. Oftentimes, my melasma patients will tell me that people tell them, "You have dirt on your face," when it's really just their melasma. And patients with birthmarks say that too, that people will tell them, "Oh, you have something on your face." So if you see somebody with something on their face, just don't say anything unless you know them really well. So what does melasma look like? So melasma consists of irregular light brown spots that are usually on the forehead, nose, cheeks, upper lips, or chin, and very common to relapse with sun exposure. You may be doing really well with your melasma, and you have a few hours in the sun, and then poof, it comes right back. So what causes this? First of all, genetics. It's always fun to blame mom and dad. And then UV and visible light exposure as well. So we're looking at this part of the spectrum. So ultraviolet light, which is UVA, UVB, and visible light, which is things like blue light, which we get from laptops or TV screens. Also, hormonal factors. So, pregnancy, melasma is called the mask of pregnancy. Also, birth control. If you're starting a birth control, changing, getting off of birth control, that can cause it as well. And also, hormone replacement therapy. In addition, skin irritation. Let's say you have a chemical peel or a laser treatment that can worsen melasma, thyroid as well, or other medical conditions, and certain medications. Quickly, let's go over skin. I know this is boring, but this is important for treatment. So, melanocytes are very superficial in the skin. Melanocytes, the way they work is they make pigment. The pigment is transported up to the very top of the skin, and then that's what we see as our skin color, basically. The process of going from the very bottom of the epidermis to the very top takes 28 days. So, treating melasma, it takes a while to see the effects of what you're doing. So, normal melanocytes making a normal amount of pigment compared to melasma, where the melanocytes are in overdrive. And what is stimulating those melanocytes? Well, what we just went over: hormonal factors, sun irritation, thyroid medication, whatever, which one of these is causing overstimulation of the melanocyte. So, in an ideal world, we would treat both of these factors. If there's a birth control that's causing it, hopefully we can change that birth control, and we can also uh, try to quell the overstimulation of the melanocyte as well. We'll go over the melanocyte. I know this is boring. This, I think, will make sense when we go over the treatment, though. So there are 4 steps to make pigment that we care about. Step number 1: the melanocyte itself needs growth factors and nutrients from the blood. So that's step 1. Step 2 is a critical enzyme called tyrosinase, which is required to make pigment. Step 3, we need to transport the pigment from the bottom to the very top of the skin. And step 4, the dead skin cells slough off. Those are the 4 steps. We can stop each of these 4 steps that can help treat melasma. So, step number 1: tranexamic acid stops the nutrient and growth factors from being able to go into the melanocyte. Step number 2 are the tyrosinase inhibitors. Many of these are over the counter. Hydroquinone is the gold standard. Also, niacinamide retinol decreases the transport of the pigment up to the very top of the skin. And also, glycolic acid retinol, that just increases sloughing of the dead skin so the skin looks lighter in appearance. If you're using different ingredients, it's best to use ingredients from different steps. So, for example, if you're using both azelaic acid and vitamin C, that may not be as effective as using azelaic acid and niacinamide and tranexamic acid. So, best to use things from different steps. Also, I'd like to point out retinol. Retinol is involved in 3 of the 4 steps. So, retinol is a great bang for your buck for treating melasma. So, your treatment overview. The most important part of treatment is strict sun protection. If you're not doing strict sun protection, you may as well not even continue in the treatment algorithm because whatever you do, it's just going to come back. Usually with melasma, you try over the counter treatments first, which includes basically what we just talked about. If you've been using those for a few months and haven't made much progress, then you can see your beautiful dermatologist who will likely prescribe hydroquinone, tretinoin, or triluma, which is a combo of the both of them. And if it's been a few months and still not making as much progress, then we go into our second line to treat melasma, which include more prescriptions and also procedures as well. When we're treating melasma, these two steps, the sun protection and over the counter treatments, these are mandatory. Do not pass go if you're not doing these two things. Over the counter, these are known as non hydroquinone lighteners, and they're safe to use, which is why they're over the counter. But we don't even move on to prescriptions or procedures if you're not doing basically those two things. So, first of all, lifestyle. Your lifestyle is a lifestyle of sun protection, basically. The most important is sunscreen. We particularly like tinted sunscreens, which have iron oxides in them. I think of this as an iron shield because it protects against visible light as well. These are some tinted sunscreens, and also you should reapply every 2 to 3 hours. I know this is a pain, I don't do it either, but here's some factors or some products that can make it a little bit easier. You can get sunscreen in stick form, you can get it as a powder, sunscreen cushions, which are more common in Asian beauty, and also UPF hats of varying degrees of cuteness can also help with sun exposure. There's also a quote unquote sunscreen supplement, which is called Polypodium lugotomus. Don't come at me for the pronunciation. This is a fern in Central and South America, and it's rich in antioxidants. And you can buy this as a pill. It's called HelioCare, and you can take it every day, and it just protects from sun damage. We think of it as a internal sunscreen. You still need regular sunscreen. It's not a substitute. It's just adding on to protect against the UV radiation. So, over the counter treatments, these are our friends that we're well acquainted with since we went over the melanocyte. So, we know those 4 steps, and we know that these are reducing the different steps of making pigment. So, azelaic acid, one of our favorites. These are some good choices. Azelaic acid tends to pill, so it's not the greatest product to use basically during the day. You can use it at night. Also, retinol, our favorite, intervening in those 3 steps. So these are some good retinols. Retinol is stronger than retinol if you can tolerate it and not get too dry. Tranexamic acid, that one step that's between the blood vessel and the melanocyte, these are some good products to use. And also niacinamide, which is decreasing the transport of the pigment to the top. These are some good niacinamide products. And again, if you're using basically from the same category, better to use from different categories. And there are products that include ingredients from multiple categories just in one product, and it makes it very easy to use. For example, Faded by Topicals. This includes all of these products, so basically from 3 different steps. So that's a very good one to use. This lightning wand also contains ingredients from all 4 steps, so that's very good to use as well. And also our favorite, Dr. Idris, and her Major Fade Flash Mask that includes 3 different steps. So another great option as well. Going on to prescriptions. First line prescriptions are hydroquinone, and we'll get into second line prescriptions as well. So, hydroquinone, like I said, it's the gold standard skin lightening topical. It decreases the tyrosinase, which so we can't make pigment basically. And hydroquinone is banned or restricted in many countries, including the EU, Japan, the US as of 2020, and Australia. So, why is it banned in these countries? So there's an increased cancer risk that's been seen in animals, not in people, but in animals. And also, if you overuse hydroquinone, it can turn your skin black and blue. We call this exogenous ochronosis, and that's with chronic use of hydroquinone. I've only seen this a couple of times, and both patients were, I think, from an Indian descent, and they were both in their like 60s or so, and they had been using over the counter products from India for many, many, many years. So those products likely had hydroquinone in it, and then they get the exogenous ochronosis. So that's something to be thinking about if you're using hydroquinone. Hydroquinone comes in different percentages. Usually, if we're doing prescription, we try to keep it around like 4 to 8%. The highest I've seen that I can prescribe is 12%. But generally, whenever we're using hydroquinone, we try not to use it alone. We try to use it in conjunction with some non hydroquinone lightener. The other thing that we can prescribe is tretinoin, which is the prescription version of retinol. Again, this intervenes in those three different steps, so we love tretinoin. And then lastly, triluma. Tri, you'll be thinking three, so it contains both hydroquinone, tretinoin, and a steroid to reduce inflammation. One thing that I see patients do incorrectly with their triluma is you need to keep it in the refrigerator. I think sometimes patients don't know that. And for severe cases, you can take a pill called tranexamic acid. So that is, or tranexamic acid is an enzyme that breaks down or blocks an enzyme that breaks down blood clots. So we can think of that as a pro-clotting medication. Tranexamic acid is normally used in high doses for heavy bleeding. So, heavy menstrual bleeding, if you're bleeding from surgery, if you have hemophilia and you're getting a procedure, you use high dose tranexamic acid. When we're treating melasma, we're using low dose. So the dose is so much smaller compared to those bleeding or the high dose bleeding related dosing. And usually it's about 325 milligrams 2 times a day. And you only do that for a few months, it's not forever. But nonetheless, there is still a risk of clot. So we really look at your risk factors. We may do blood work, look at if you're on a birth control, and just see if you're a candidate. But again, this is just for very severe cases. We don't do this commonly. Now on to procedures. So procedures include chemical peels, microneedling, lasers, IPL. First, glycolic acid. We love glycolic acid as a peel. It's great for melasma, good for basically skin aging as well, but it does cause some inflammation and not everybody can tolerate it. A gentler option is a mandelic acid peel. Mandelic acid, the molecule is much bigger, so it penetrates slowly and gently. It's also antibacterial, so if you have kind of oily skin in general, it's a good treatment option. Next, microneedling. We have regular microneedling, which helps as well, but even better than that is using microneedling and topicals. So you can microneedle with tranexamic acid or vitamin C, and then it works even better. There was a study that was done that looked at patients with melasma, and they were wondering what looks better or what works better, just plain microneedling or microneedling with a topical. And they looked at 10 patients and they did a split face study, which is our favorite kind of study because it's very easy to compare them. And they found that the microneedling alone side, the darkness decreased by zero point 0.3 points, and the microneedling and topical side decreased by zero point 0.8 points. So that worked even better. So their conclusion was if you microneedle, and in this case they use epidermal growth factor, but if you microneedle with a topical, it enhances the benefits and it works even better. There are also laser treatments you can use for melasma. Commonly, we use Clear and Brilliant, Fraxel, Halo. All of these lasers are heat based, so they can also worsen melasma if not used correctly. One laser that I really like for melasma is called a Q-switch laser, and that is not heat-based, so it's not likely to inflame or worsen your melasma. But how that laser works is the melanocyte itself is very delicate, and it has these finger-like projections that go out into the skin, and that's what releases the pigment to the top of the skin. What the Q-switch laser does is it just damages these finger-like extensions so that the pigment just cannot get to the top of the skin. So this is a great option that does not involve heat. Also, in addition to laser, we have light treatment as well, which is intense pulsed light or IPL. This is a light, not a laser, so it has multiple wavelengths involved. It's less precise, though, if you have melasma, you have brown pigment, and you have big vessels, you have red as well, it can treat both of them. whereas a laser is more precise, but it only has one wavelength and it has one task basically. So both IPL and laser are options depending on what you're looking for. So that, ladies and gentlemen, was melasma. In summary, use your sun protection, use over the counter products, and if you need to see your beautiful dermatologist, they will prescribe usually hydroquinone or go on to procedures if you need it. So that's melasma, and thanks for watching.